This was a trial to investigate whether inflammation contributes to increased cardiovascular risk in patients with rheumatoid arthritis. So we know that people with RA have more heart attacks, strokes, and heart failure than people without RA. And the hypothesis that's been out there for a long time is that this is driven by inflammation. But what was lacking is that we hadn't measured it in the area where it's really important, in the blood vessels. So our question was whether there's inflammation that we can measure in there, and specifically whether treating it with RA medications could lessen that risk. So the very gratifying answer was that yes, both treatments decrease inflammation in the blood vessels pretty equivalently.
We were able to take a number of candidate biomarkers using some NIH support and FNIH support to study the relationship of these various biomarkers with the vascular inflammation that we observed in the TARGET trial. Our initial readout, which was published in the last year in the Journal of the American Heart Association, suggested that there were at least 6 biomarkers. These are the biomarkers that we're now taking forward in further cohort studies.
This is very accessible in the rural community, in clinics for all patients. So there's a broad, larger understanding and accessibility that comes out of this, not only for rheumatoid arthritis, but I believe many of these cardiovascular and vascular inflammatory targets become things across other autoimmune conditions.
The fact that we were able, through the FNIH funding, to get blood samples on 150 patients, not just at the beginning of the trial, but throughout several visits in the trial and at the end of the trial, is really phenomenal. And if we can show that those biomarkers really do predict cardiovascular outcomes of some type that are clinically important, then that's much easier to do day to day in patients with rheumatoid arthritis.
Having the Arthritis Foundation and patient advocacy groups involved, that is one of our key missions at FNIH, is to bring the patient voice to the table, not only for this project, but on all of our projects. We really want to make sure that we have high impact to our patients and work together with these patient advocacy groups to make sure that the results get disseminated out to the community and to the patients, and that they're aware of the research that we do to advocate for them for autoimmune disease.
For me, it's very gratifying to see how the work that's been supported by FNIH and by the project team is going to have like legs for years to come. It's not over. And that's important for the community that's interested in these issues, not just for one specific finding, but for the ability to kind of fuel the science going out into the future.
The cardiovascular system was one that was not the last frontier, but one of the later frontiers. And so I think that being able to impact patients' lives through that mechanism by reducing cardiovascular disease as well is really important.